Ibuprofen is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibuprofen is a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. This form of ibuprofen is intended for use in children. Do not give this medication to a child younger than 2 years unless directed by the doctor. When taking children's Profen IB, it's important to follow the directions provided on the product package or as prescribed by your doctor. This medication is usually taken by mouth every 6 to 8 hours as needed. Be sure to shake the bottle well before each dose and use a special measuring device to ensure you get the correct dose. If you experience stomach upset, you can take the medication with food, milk, or an antacid. The dosage of children's Profen IB is based on your medical condition and response to treatment. To reduce the risk of side effects, it's important to take the lowest effective dose for the shortest possible time. Do not increase your dose or take the drug more often than directed. For children, the dose of ibuprofen is based on their weight. Be sure to read the package directions to find the proper dose for your child's weight, and consult the pharmacist or doctor if you have any questions. If you are using children's Profen IB as needed, it's best to take it at the first signs of pain to maximize its effectiveness. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. And if you are using the non-prescription product for fever or pain and the symptoms worsen or last for an extended period, it's important to consult a doctor. Some common side effects of children's Profen IB may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to note that many people using this medication do not experience serious side effects. However, this medication may raise your blood pressure, so it's important to monitor your blood pressure regularly and inform your doctor if the results are high. Seek immediate medical attention if you experience any serious side effects such as easy bruising/bleeding, changes in hearing, mental/mood changes, signs of kidney problems, vision changes, symptoms of heart failure, or symptoms of liver damage. Although it is rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Nonsteroidal anti-inflammatory drugs, like ibuprofen, may rarely increase the risk for a heart attack or stroke. This effect can happen at any time while taking this drug but is more likely if you take it for a long time. The risk may be greater in older adults or if you have heart disease or increased risk for heart disease. Do not take this drug right before or after heart bypass surgery. This drug may rarely cause serious bleeding from the stomach or intestines. This effect can occur without warning at any time while taking this drug. Older adults may be at higher risk for this effect. Stop taking ibuprofen and get medical help right away if you notice any of these rare but serious side effects: stomach/abdominal pain that doesn't go away, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, sudden vision changes. Talk to your doctor or pharmacist about the benefits and risks of taking this drug. Before giving children's Profen IB to your child, it's important to talk to your doctor about any allergies your child may have, especially to ibuprofen, aspirin, or other NSAIDs. Let the doctor know if your child has a history of asthma, blood disorders, heart disease, high blood pressure, liver disease, or kidney problems. If your child is dehydrated, has heart failure or kidney disease, or is taking certain medications, they may be at a higher risk for kidney problems while using this medication. Be sure to give your child plenty of fluids as directed by the doctor to prevent dehydration and watch for any changes in their urine output. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important for your child to avoid driving, using machinery, or doing anything that requires alertness until they can do so safely. There is a risk of stomach bleeding with this medication, especially when combined with daily use of alcohol and tobacco. It's important for your child to limit alcohol and stop smoking while using this medication. Children using this medication may be more sensitive to the sun, so it's important to limit their time outdoors and use sunscreen and protective clothing. If your child has diabetes, phenylketonuria, or any other condition that requires them to limit or avoid sugar and aspartame, be sure to talk to your doctor or pharmacist before using this product. This medication may also affect women of childbearing age, so it's important to discuss the benefits and risks with the doctor, especially if the child is pregnant or planning to become pregnant. This medication is not recommended for use after 20 weeks of pregnancy. If it's necessary to use this medication between 20 and 30 weeks of pregnancy, the lowest effective dose should be used for the shortest possible time. It's important to consult the doctor before breastfeeding if the child is using this medication. When taking children's Profen IB, it's important to be aware of potential interactions with other medications. This includes drugs like aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, and diuretics. These interactions can affect how the medication works and may increase the risk of serious side effects, especially those that can cause bleeding. It's also important to carefully read the labels of all prescription and non-prescription medications, as many of them contain pain relievers and fever reducers that are similar to ibuprofen. If you are directed to take low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it unless your doctor instructs otherwise. However, daily use of ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. In this case, it's best to talk to your doctor about using a different medication to treat pain or fever. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen, and make sure to take ibuprofen at least 8 hours before or 30 minutes after your aspirin dose. As always, do not increase your daily dose of aspirin or change the way you take aspirin or other medications without your doctor's approval. If you suspect an overdose and see serious symptoms like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the U.S., call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, difficulty breathing, and extreme drowsiness. If your doctor has prescribed children's Profen IB, it is important not to share it with others. Your child may need to undergo lab and/or medical tests, such as blood pressure and kidney function tests, while taking this medication. It is important to attend all scheduled medical and lab appointments. Consult your doctor for more details. If you are using children's Profen IB on a regular schedule and you miss a dose, take it as soon as you remember. If it is near the time of the next dose, skip the missed dose and take your next dose at the regular time. Do not double the dose to catch up. This medication is typically taken every 6 to 8 hours as needed for pain or fever. It is important to store children's Profen IB at room temperature, away from light and moisture. It should not be stored in the bathroom and should be kept out of reach of children and pets. When it comes to disposing of children's Profen IB, do not flush it down the toilet or pour it into a drain unless instructed to do so. It should be properly discarded when it is expired or no longer needed. It is best to consult your pharmacist or local waste disposal company for the proper way to dispose of this product. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.